Peter, we were just talking earlier about whether the measures to address the second round are more sophisticated and more effective at this stage. What's your reading when we look at France and Spain and how they are now negotiating their healthcare systems and this spike? Are they doing it in a more effective manner?
Well, I think everyone is trying to find a balance right now in terms of having enough restrictions to stem what in some cases are fairly steep rises in new infections, certainly in Spain, France, and in the UK, whilst not resorting all the way back to those very extreme lockdowns that we all suffered through back in March. It's true, of course, that we know a lot more about how the virus operates and propagates and is transmitted. It's true that our testing capabilities are much higher, and it's also true that we have more effective treatments and knowledge about treatments that we did, which hopefully will be able to keep death rates down. That said, we are seeing in some countries rates of infections climbing kind of on that exponential growth trajectory. And so even if the number of actual cases is still lower than it was back in March, if the measures in place over the next couple of weeks don't do enough, we still could be in a very dangerous place as we enter difficult winter months.
Do you think that governments are willing to accept a higher level of infection rate at this stage in the balance of infection Vs keeping economies open because the treatment seems to be reducing hospital admissions and the fatality rate?
I don't know. I don't want to speak for those governments. I think what we've learned actually is that the best way to keep economies going, or the countries that have been most successful in doing so, have taken a strategy of elimination. That's trying to reduce the level of transmission, the number of cases, as much as possible. We do have to be careful right now in places where we've seen upswings over the last couple of weeks. Everywhere that we've seen a rise in cases, the US is a great example. In those first few weeks, hospitalization and deaths are low because they're lagging indicators and because a lot of the people being infected are younger, healthier people. As that wave continues, infections generalize into the population. You start to see more older folks and medically vulnerable folks who may have been shielding also get infected, and then hospitalizations and deaths rise. So while I am confident that the infection fatality ratio may go down because of the effective treatments, if we don't get this under control, in my opinion, we'll see an unacceptably high number of deaths.
Peter, there are so many contentious issues amidst this whole crisis as well, and amidst the pandemic. But one of them seems to be, is the Swedish model right or wrong as well? Now, we know that they had their own devastating care home problem as well. But in terms of their drive for a herd immunity amongst the broader, healthier part of the population as well, do we have any evidence yet that the Swedes have got it right or the Swedes have got it wrong?
Yeah, it's probably best not to think about it in terms of right or wrong, but in terms of lessons from Sweden and lessons from elsewhere. They obviously took a very different strategy early on, saying, look, a vaccine is not right around the corner. We have to find a way to live with this, and took that herd immunity approach, the idea being, let's try to shield the most vulnerable and let the infection work its way through the population so that enough people could gain some level of immunity from infection in order to provide some population level of protection. I do think that's a very dangerous idea, and even at low rates of death, the kinds of infection rates you would need to see, 60–70% of the population, would lead to a very significant number of deaths. Here in the UK, we'd be talking about 500,000 or so deaths to pursue a herd immunity strategy based on what we understand of it. Now, if you look at Sweden, even though their restrictions were much, much lighter and they never entered a lockdown, their death rate by population is among the highest in the world. It's almost as high as the UK, and actually the economic hit that they took is similar to some other countries that had severe lockdowns. So it's hard for me to say that they came out of this so much better. And in fact, now in Stockholm, we're seeing rising number of cases and more restrictions. I think there are lessons to be learned from there. I don't think it's right. A better model perhaps might be Germany, which also was able to avoid some of the more draconian lockdown measures. One thing they've done really, really well, and I wish the UK would look at more, is really invest in very strong testing and contact tracing systems. When those things are working effectively, you can get on with a little bit more normality and social and economic activity and not have the very severe restrictions.
Peter, a number of experts have rejected the notion of waves, first wave, second wave, and think there's just one continual move that you're seeing in COVID. But the reality is, after the first wave that we witnessed with this very strict requirements, the lockdowns and restrictions, that the R rate dropped in so many different places. This time around, as we just limit the amount of measures the government wants to take up because of the economy, what's it going to take? When do you think we'll see the next lull in COVID spikes and the R rate coming down? You know, what should we be thinking about? Is it going to take much longer this time than a couple of months?
I think it may, right? The way we're responding to it now is quite different than what we did back in March. We're not going into strict lockdowns, and I think it's going to take a lot before any country would resort to a national lockdown again. What that means, however, is that sort of more cautious measures on physical distancing are not going to flatten the curve as quickly or as dramatically as a lockdown did. So what that means is that, for example, in the UK, where we're just implementing new measures this week to try to slow the spread, we might see that slope start to kind of flatten off very slowly, but we're not going to see it, sort of dip back down. And so with the kinds of measures we're taking, I wouldn't expect that we're going to get back down to low levels of transmission anytime soon. Of course, the other thing is that we're entering a period in the winter months where more people are going to be driven inside, where the risk of infection is maybe 18, 19 times higher than when you're outdoors. And so we're continuing to face risks that are going to put the virus at an advantage. So with the current package of measures, I think it's likely we might see sustained transmission through the winter, and it's going to be a balancing act. We may see further restrictions come into place in the coming weeks.